Postnatal questions. 1. A client whose blood type is A negative birth to a neonate whose blood type is A positive. The client is scheduled to have RH immunoglobulin administered. Before administering the medication, which action by the nurse is most important? A. Ensuring that the client understands the procedure and signs a consent for the vaccination. B. Choosing an injection site that is not tender. C. Instructing the client that she will not need an additional vaccination after her next pregnancy. D. Documenting administration for the drug in the client's chart. The correct answer is A. Ensuring that the client understands the procedure and sign a consent for the vaccination. 2. At the beginning of the shift on the postpartum unit, a charge nurse notices that the licensed practical nurse is working with an acting improperly and smells of alcohol. When the charge nurse confronts the LPN, apologizes and promises that she will never report to work in this condition again. Which step should the charge nurse take next? A. Rearrange the nursing assignment so that the LPN performs paperwork for the rest of the shift. B. Notify the shift supervisor and rearrange the patient care assignment. C. Assign the LPN to the nursery where she can sit and rock babies. D. Tell her that she is acting irresponsibly and that it's better to not happen again. The correct answer is B. Notify the shift supervisor and rearrange the patient care assignment. 3. When caring for a client who has recently given birth, the nurse asks the client for urinary retention with overflow. Which sign or symptom provides the most accurate picture of retention with overflow? A. Frequent trips to the bathroom with an average output 200 to 300 ml per void. B. Intense urge to urinate with an average output of 250 ml. C. A verifying urge to urinate with an average output of 100 ml. D. Uterus displaced to the right with increased vaginal bleeding. The correct answer is C. A verifying urge to urinate with an average output of 100 ml. 4. Which practice should be a nurse recommend to a client who has had cesarean birth? A. Frequent touch after cease discharge. B. Coughing and deep breathing exercise. C. Doing sit-ups 2 weeks after birth. D. Side rolling exercise. The correct answer is B. Coughing and deep breathing exercise. 5. A nurse is providing teaching to a postpartum client who has decided to breastfeed her neonate. She has questions regarding her nutritional intake and wants to know how many extra calories she should eat. What number of additional calories should the nurse instruct the client to eat per day? A. 300, B. 150, C. 200, D. 500. Answer D. 500. 6. A nurse is assessing the parent-neonate attachment of postpartum client. Which finding most indicate a need for further evaluation? A. Parental desire to room in with the neonate. B. Limited parent-neonate contact immediately after birth. C. Parental understanding of the importance of parent-neonate bonding. D. Previous cesarean birth. Answer B. Limited parent-neonate contact immediately after birth. 7. A client with a past history of varicose vein has just given birth to her first neonate. The nurse suspects that the client has developed a pulmonary embolus. Which findings support the nurse suspicion should all that apply? A. Sudden dyspnea. B. Chills, fever. C. Diaphoresis. D. Hypertension. E. Confusion. The correct answer is sudden dyspnea, diaphoresis, confusion.